Before you think this video does not concern you, ask yourself these questions. Why are my fibroids getting bigger? Why do I still have fibroids even after having a surgery done? Now, if these questions have crossed your mind at a point in time in your life, then definitely this video is for you. So stay tuned and listen or watch to the end of the video. Have you ever wondered why you have fibroids and others don't? What are the risk factors for your fibroids? Now, risk factors are factors in an individual that increases the risk of acquiring a disease condition. Most times, they're actually risk factors for these fibroids. Unfortunately, in some, there's no clear reason, no clear risk factors. Your body just develops uterine fibroids. So what are some of the risk factors? We have age. Fibroids are more common in women between the ages of 30 and 50. You don't find fibroids in a girl that's not started her period, and usually after the age of 50 or once a woman attains menopause, fibroids reduce or new fibroids cannot grow. The female hormones estrogen and progesterone play an important role in development of fibroids as well as the growth of fibroids. Can you inherit fibroids? Yes. If your mother, sister, or grandmother had fibroids, then there may be a higher risk of you developing fibroids. Fibroids are more common in black, so if you're black, yes, you might have fibroids. Lifestyle plays an important role in the development and growth of fibroids, mainly by influencing the hormonal level, inflammation, and your overall health. There are certain habits that can either increase or decrease the risk of fibroids. Poor diet, obesity, lack of exercise, taking alcohol, taking caffeine, and exposure to environmental toxins. And let's not forget stress. Stress raises cortisol, which can also disrupt your estrogen balance and then lead to emotional eating, worsening diet quality, and all that. Before you start wondering, why do you have this? Why do you have fibroids and your friend does not have fibroids? You don't know what your friend is dealing with. Your friend may be dealing with cancer or something different. Would you want that instead? I'm sure the answer is no. So the key is identify what are my risk factors. And if you have risk factors for fibroids or risk factors for fibroid growth, then you try to eliminate these risk factors to give you a better quality of life. There are modifiable risk factors and there are non-modifiable risk factors. So having a risk factor is not a problem, but can that risk factor be modified? So let me give an example. Somebody's mom has diabetes, father has diabetes. That is a risk factor for her to develop diabetes. But does that mean she's going to develop diabetes? No. If she lives a healthy life, she may not develop diabetes, even though she has risk factors. Risk factors for fibroids that are modifiable. If you can modify them, you not only reduce the chances of having fibroids, but even if you already have fibroids, you reduce the chances of those fibroids getting bigger. And so this is why even after a surgery or whatever medication to reduce the size of the fibroids can either persist or be grow because the underlying risk factor still persists.